New videos every day.
I like to know things.
Hi, I'm Dr. Moria Dolan, internal medicine physician with the Medical Accountability Network. A lot of people have been asking what is the connection between violence, suicide, and homicide and antidepressant medications. Let's take a look at this. There are numerous examples of people who have gone off on a shooting rampage and then killed their classmates, their co-workers, members of their family, and then often took their own lives, and then it was shortly discovered that they were taking an antidepressant. The apparency is that the person was mentally ill and then went off on a rage. But when these cases have actually been looked at closer, what we find is that the person did not have any violent tendencies, and in most cases was not even suicidal before they started treatment with their antidepressant medication. Well, let's take a look at what the manufacturers say about their own drugs in this class called antidepressants. I'm going to be reading here from the package labels of various antidepressant medications. Now, the labeling is something that is required by the FDA. The wording of the labeling is FDA approved and required. So let's take a look at what the FDA has required the manufacturers to reveal in their product labeling on the antidepressant drugs regarding violence, homicide, and suicide. I'm going to start off looking at the package insert for Prozac. Prozac is also known as fluoxetine. And here is some things that the manufacturer themselves say about this drug. One of the things that the manufacturer warns us, and the FDA requires the manufacturer to let us know on the labels, these drugs can cause what's known as akathisia. Akathisia is simply a medical word that literally means can't sit still. And it has two parts to it. The first part is what you can actually see in the person, the motor part of it. A person cannot sit still. They have restlessness, toe tapping, shifting from leg to leg, pacing. In any case, they can't sit still. They try to sit down or even to lay down, and next thing you know, they're hopping up again, and they're pacing, they're fiddling, they look and act agitated. This is a straightforward chemical effect of the drug. It causes not just the motor action, in other words, the muscles to be jumpy and to get the person moving around. It also causes an internal restlessness. So a person has a real sense of unease. They feel just like their body has to move. They feel compelled to action. It's called psychomotor agitation, that not only are they mentally agitated, but also their body is expressing that. They have a real subjective sense of just distress. Something's got to happen, got to do something. Well, let's take a look at what the manufacturer says, in fact, about violence. These drugs can cause agitation, psychosis, hallucinations, hyperkinesia, again, that's the agitated movements. These drugs can cause a sense of depersonalization, and that is where a person just feels that everything around him is not real, sort of a dreamlike state. These are actually listed adverse effects of the drugs on the label as required by the FDA. They list as a frequent side effect agitation, amnesia, no memory for what took place, confusion, Emotional lability, that means moods all over the place. And sleep disorder. Now the sleep disorder can be excessive sleepiness or an insomnia. If you add lack of sleep on top of the tendency of the drug to cause psychomotor agitation, a feeling of the person that they've got to go do something, along with the depersonalization that they can get, you really have cooked up the chemically induced ingredients for a mass murder. Well, Prozac is the label that I've been reading from here, and it is a so-called SSRI. That stands for selective serotonin reuptake inhibitors. In fact, these drugs are not selective. They work on several different brain chemicals, including serotonin, norepinephrine, dopamine, and others. And in fact, what they do is not simply block reuptake, but they have many actions at different receptors throughout the brain. There are also over 20 known serotonins in the brain, so exactly what serotonin levels are being provoked to be increased or decreased or upregulated or downregulated by the so-called SSRIs is not very well known. In fact, on the label for Prozac, and again I'm reading from the label, we find that the mechanism of action is in fact unknown. You will find that mechanism of action of all of the so-called SSRIs is unknown. Theories abound. And the label goes into detail as to what the theories are and to what it's thought the drug might be doing. But in fact, the mechanism of action is entirely unknown. What we can witness is what effect it has on the body and on behavior. So back to the adverse effect section of the Prozac label. I'm going to read to you some of the other central nervous system effects that this drug can have. Ataxia, this means unbalanced walking. Bucoglossal syndrome, this means lip and cheek, mouth sort of smacking, irregular kind of spasmodic movements. Depression of the central nervous system, stimulation of the central nervous system, euphoria, hallucinations, hostility, fast movements, increased muscle tone, increased sensations. In other words, they feel things at a heightened level, but it can also cause decreased sensation, inability really to feel the normal things such as pain and pressure that a normal person would feel. Paranoid reaction, psychosis, dizziness. So here we have hostility, paranoia, agitation, combined with the akathisia, which is a sense that I've got to go do something. And you could see how these can all add up to irrational murders. The string of school shootings that we have seen is strictly a phenomenon that coincides with the massive use of these drugs over the past 15 to 20 years. It was not something that was seen in the 20 years earlier. In the 20 years that we've seen an increase in mass murders in people who are chemically altered by antidepressant medications, that's been the same 20 years where there's been nothing but increased gun control. So we do have the suicide warning for 26 and under across this group of drugs, as well as the akathisia, hostility, psychomotor agitation, paranoid ideas, hostility, and of course what comes out of that is violence.